Welcome, everyone. Thank you for listening to our webinar, Delivering Clinical Conversations Through Telehealth Adoption During COVID-19, sponsored by Rhinogram. My name is Erica Grau, Director of Marketing here at Rhinogram. I wanted to thank everyone for understanding the technical difficulties during our first session. We apologize for any inconvenience. Although we won't be answering any questions here live, we will share our contact info at the end of this presentation and can help answer any questions you may have. We would like to thank again Rebecca Francis, the entire Tennessee MGMA team for having us present. Now let's meet our speaker. I am joined today by Kathy Ford, President and Chief Product Officer at Rhinogram. Kathy is a healthcare industry veteran with over 25 years of experience, including roles at GE Medical Systems, McKesson, Siemens Medical, Carestream Dental, and Nant Health. She is internationally recognized for pioneering and commercializing more than 100 clinically impactful solutions used around the world today. Becker's Hospital Review selected Kathy for the 102 Women in Health IT to Know for 2019. She shares this list with the likes of Judy Faulkner and other accomplished women in this space. All right, Kathy, let's jump right in.
Thank you, Erica. And again, I would like to echo our sincere apologies for the technical issues earlier today. And thank you all for joining me in this really important conversation about COVID-19 and how telehealth can play a great role in getting us through our reality today. So what I want to talk about are really three areas of telehealth. So first off, how can your practice continue to deliver high quality care through the realities of COVID-19 and the requirement to keep ourselves at home and our patients at home as much as possible and continue to contribute to flattening the curve? I want to share with you three real examples of practices that have successfully deployed telehealth in their practices and also using it for remote patient monitoring as well, and talk about what it's meant to them. And then lastly, I want to cover some really important points when looking at your telehealth platform and capabilities that will be really important to your success in rolling out this new method of care. So the topic at hand, we're hearing telehealth in every conversation now, as the government has certainly provided expansion as it relates to the use of telehealth in the home. They have lifted limits of frequency for telehealth, in some cases waived some of the restrictions altogether. The Federal Communication Commission has also recently released $200 million in grants to many qualifying healthcare systems and practices throughout the US in order to help drive the adoption of virtual care, virtual visits, in order to flatten that curve as quickly as we can. What I've been doing over the last 45 days is talking to our clients and really trying to understand what has been the true impact of COVID-19 on their practices, with their patients, with their staff. And I'm asking them, what can Rhinogram do to help? How can we better assist? And really share with me, what's going on at the front lines. And they're all saying many of the same things. So, what we know is that many specialties have had to close 100%, which is just really unheard of. And, some of those specialties include dentists, orthodontists, endodontists, as well as some other specialties like orthopedics and allergy and some others, where they may be looked at as non-urgent specialties, or at least the treatments primarily are not so urgent. So this, of course, is driving other activities, which is a high number of cancellations and then no-shows because patients are not sure whether they should be coming in. We're all hearing the very firm and clear directives from the CDC to stay at home as much as we can. And a lot of patients are also making assumptions about practices being closed, and so they're not showing up when staff is there ready to support them. And then on the other side of things, practices are seeing an extreme increase in patient call volume. Honestly, before COVID-19, I don't know that I've ever spoken to a practice that didn't have challenges around managing call volumes. Seems to be generally high most of the time. But now when you have a situation where patients need to call first before they come in, and we want them to be triaged before they go anywhere, of course, but how do practices manage this? And especially if you've now furloughed some of your staff, if they're on reduced hours, the only way to answer the phones typically is if you're in the office. So this is a real problem right now. Patients, if you're not a COVID-19 patient, you likely have patients that are still being treated for other issues. Patients with chronic conditions, patients on care plans. How are we making sure that those patients are staying healthy, are staying compliant, are still feeling engaged when they can't go to the office, when they have to delay those appointments? And then, what may happen to some of those managed patient issues? Will they progress? And then your staff. If your staff is not coming in together, how are you staying connected with each other? And how are you doing it in a compliant way? You want to be able to give your staff a way to message, ask questions, talk about patient approaches in whatever may come up, but they need a platform in order to do this. And then lastly, in a lot of practices, the way to use your tools sometimes means you really have to go in the office to get to them. Sometimes that's logging into your EHR or your practice management system. Because that's the computer that you have access to. Again, the office phone usually only rings in the office, things like that. So these seem to be really prevalent across all of healthcare right now. So what do you do if you're seeing a patient? This is one of the questions that our practices are asking Rhinogram. What should we do? And really what's probably the most important thing to say in whatever your situation is stay engaged, right? So at a time when we need to socially distance ourselves, we need to clinically non-distant ourselves. We need to do the opposite of that, but we have to obviously use different means to do that. Think about, if you want to, in your particular market, think about being considered that emergency provider. If you have a really good telehealth platform that's super convenient to patients, doesn't require them to learn anything new or download something, but you make it super convenient for them to get to you, then you will be a relied upon provider. You can be that emergency triage rather than the patient deciding to go to the emergency room. We all know we want to avoid that. If you are seeing patients, you do want to make sure that you know that they are not presenting symptoms of COVID, and so that they are not putting anybody else at risk in your practice if your practice is open. Best way to do that is to pre-screen them. Best way to do that is to ask them a series of questions. And the easiest way to do that is to do it by way of text. It's just simply the most convenient, especially because patients can be texting and practices can be managing multiple text message conversations at one time. It's so much more convenient than the phone. And as long as it's HIPAA compliant, your platform, and people are not texting using their personal phones, then you have a permanent record of all those conversations as well. So leveraging a platform in order to help triage and understand any kind of conditions and symptoms your patients may be experiencing, so that you could better help them decide what needs to happen next, is going to be a key to success. You also want to make sure that patients feel like they can initiate a conversation. Oftentimes, again, if patients may be looking for the practice to be reaching out to them, we want to make sure if a patient has any kind of a concern in any way whatsoever, that they feel like it is the easiest possible way to get connected to their healthcare providers, to clinical staff, to the team. And then last kind of key point here, which was pretty universal across our clients, making sure that you've got all your questions and concerns addressed before that patient comes in. Again, whether it is asking them, going through a symptom list of temperature, of cough, of other kinds of concerns, any other questions, again, non-COVID related. Do they need a prescription refill? Do they need to come in at all? All of these things, try to do as much as you can with the patient virtually before they have to come in, I think is the key. And what you need to have in place in order to do that is a solid piece of technology that gives you a bunch of tools so that it's super easy for not only the patient, but also for your team. So on the other side of the coin, what happens if your practice is closed? We're going to get through this, we know it, but if you're closed for now, then there are some really important steps to take, and using a telehealth platform is going to help you ride this wave. So just like before, got to stay engaged. So you still have patients who have decided to put certain appointments and visits on hold. Determine which of those visits you could actually extend virtually. So again, there are many telehealth reimbursement codes that have been expanded, and many of the limitations lifted, so that whether it's COVID or non-COVID, you can be monitoring, providing e-visits, virtual consults, remote patient monitoring. There are all sorts of codes now reimbursable that allows you to stay connected. So your office may be closed, but continue to deliver care. And the way that you do that is you choose the right technology to make it most convenient for your patients and for you. Market your services. We've definitely heard some great advice from our clients about how the minute they learned that they had to close their practice, that they immediately got in touch with their marketing team. They amped up their Facebook business page to be more visible, to be more accessible using Facebook Messenger. They are marketing themselves as being open, just virtually open, making sure that patients know they can still contact them. And again, also still being available for emergencies, no matter what your specialty is. And if patients feel like they can reach you, even if your doors are closed, then they'll go to you and not to the emergency room. Using a platform, of course, is going to help you with the realities around your phone ringing and nobody there to answer it. The emails, if patients are using your portal, you may have some staff members that don't have the ability to log in remotely. Either that's a EHR limitation, or perhaps not everybody has the right equipment at home in order to do that. And so you want to make sure that it's not equipment that limits your workforce to be able to not only stay connected with the patients, but also to stay connected with each other. So a nice open platform that can live on essentially the device that all of us have, which is a phone, is really a must have. And then think about when you are going to reopen your schedule. How are you going to, what's the best way to manage those very first patients that you need to get rescheduled? Especially if you are regularly communicating with those patients virtually while you're closed. There could be certain issues that are progressing and that you need to rearrange what was your schedule before and change prioritization. So having a system that helps you to also manage that priority list and know exactly who you need to reach out to first. And again, ideally reaching out in the easiest way possible and the most efficient way, which is not the phone. We know this. So using tools like text will get you there faster and get you up and going when we're ready to start seeing patients in our offices again, which hopefully is soon. So the new normal, as we have all been hearing and talking about it, just the reality is where we find ourselves is we have to leverage technology now in order to stay connected, to get us on the other side of this crisis, which means keeping everybody at home and especially our patients, but ensuring that we're still able to deliver care. And that's really the whole point of this conversation is keep delivering the care. We all need it, but we have to figure out how to do it in a different way. And we also have to make sure that our patients know that there are other ways to receive care, to ask questions. And that means leveraging your website, making sure that it's super easy to ask questions right from there. Leveraging social media, making sure that you can integrate your social media messaging options and your business page into one single communication platform so that you're super efficient and all of that communication stream is permanently stored. And so that you're also, as you are looking at a telehealth platform, even if you're closed right now, what you're doing is preparing yourself for the future. Because as we all know and understand, COVID season, well, we'll manage it through the summer. Everybody is predicting that we will see it again in the winter. We know that the flu season is also part of our reality. So let's really leverage what technology can do for us to deliver care and keep people safe, meaning your staff and other patients, with our new reality. So let's talk about how telehealth is being used today in a couple examples. So Dr. House really took a pioneering approach to how she wanted to enter her market, being in El Paso as a newly opened practice. So she was facing a pretty competitive market, but also understood that there were many unmet needs with her population. And a lot of it was around patient experience topics. And so before she opened her practice, she wanted a platform that really resonated with her patient population and certainly the generation of her population of moms, having babies. A lot of her patients are millennials, and knowing and reading and understanding her patient population, that they prefer to text, and they prefer to text over phone calls no matter what the issue is. So how she ramped up her new practice really quickly was by implementing Rhinogram, her telehealth virtual consult platform, and she immediately started advertising the ability to text. And she differentiated herself by not only having conversations with her patients to put them at ease, answering easy questions throughout the day, but also offered virtual visits on Saturday. And that alone kept her patients incredibly loyal to her. They started recommending her to their friends, and she grew her practice really quickly in a short amount of time. And also she stood out because of her Facebook business page and messenger integration with the Rhinogram platform. It's now one of her most predominant ways that patients and new patients are communicating into her practice. Everybody, all those messages go right into the Rhinogram platform. They're completely HIPAA secured, and it's HIPAA compliant to do so. Patients are able to communicate back and forth in the way that they came in if they'd like, and they're super satisfied. So she essentially opened up a whole nother channel to reach her new patient opportunities, and then who then became her patients. Second success story, Dr. Matheson, she and her peers have a very busy practice in the Chesapeake, Virginia area. Again, lots of millennials are her patients. And as a very busy practice, an existing practice, they really were challenged with volume of needs. So lots of phone calls, lots of prescription refills, lots of test results that needed to be delivered, and we're just struggling with the phone bogging them down and not delivering the best experience. And it came through their reviews, and that was a challenge. And so by implementing Rhinogram, leveraging text, it's how they primarily communicate with all of their patients. The reviews have all been really terrific and no more complaints. So a great success story there. Last success story I'll share with you, Sweetgrass, another pediatric facility, very busy practice, multiple locations. They happen to be one of the highest Medicaid facilities in the Charleston, South Carolina area. And so with really a diverse population, they were finding it was hard to stay connected to their patients throughout their care. And when they changed directions and implemented Rhinogram and had this really convenient platform with no portal for anybody to log into, they just simply texted in, it completely changed the engagement that they were previously not having. Essentially, this practice overall is averaging about 30,000 messages a month on their platform. So they've taken their phone call volume down by about 50%, and they couldn't be happier. And their patients couldn't be happier. So now that we've talked about why you need a telehealth platform, but I think we all probably know that today, let's talk about what's really important as you're looking at a platform and what is a must-have. I think it's of no surprise that convenience is the expectation thanks to all these other services, some of which many of us are using a lot more of today or nowadays. But it is just the reality, and it certainly is the reality in healthcare as well. And COVID has really tested that and proven that. And on top of that, we also know that the phone is not the most convenient way to manage those kinds of that level of convenience and the needs, especially right now. And however, everything needs to be compliant. And so, what does that mean? Well, when we look at convenience and consumerism, there are really kind of three must-haves as it relates to getting connected with your patient. Allowing your patient to text into your practice, ideally texting on your practice's phone number line, means that they don't have to log into anything, they don't download anything, they don't have to learn anything new. Everybody knows how to text, and so you've basically just removed all the barriers. So absolutely no reason why you can't stay connected to your patients. Update your website. Make sure when you're looking for a platform that platform is going to give you tools to allow patients to communicate directly to you, and that communication is also secured into a single platform so that, again, your staff and everybody can see those messages and they can go to the right person. Third, social media integration, as I shared with our case study in many of our case studies. In fact, this is how the current generation likes to communicate. So don't leave fantastic opportunities to engage with more patients in your market, to grow your patient base, and also to offer just another way to stay connected to your patients, especially during these times. So social media or Facebook Messenger integration on your platform will really help you and also provide you with some differentiation in your market. So what's really important is with the ability to text is also the ability to triage. So when you're triaging emergencies, you need information fast. So you want a patient to be able to snap a picture and send a message and get that to you or to the right person at the right time to be able to make a determination as to what needs to happen next. Many platforms also offer video, which is a fantastic capability. I would tell you, if you don't have texting to go with your video, the video is going to be also very inconvenient. If you have texting and video, you have the perfect set, because many times triaging can take place, and as the Rhinogram clients do today, without ever having to get on a phone call or start a video session, which is ideal for everybody involved. So why not make sure that you can receive and send messages to your patients to go through that triaging process, be responsive. And then on top of that, initiate a video session if it's needed, and it may not be needed every time. In fact, what we know is it's not needed every time. And then a few other notes as far as choosing the best telehealth platform. We do know that it's all about the right conversation with the right person. So sometimes it's about a prescription refill, sometimes it's about changing an appointment, sometimes it is about a billing question or an insurance question. And these are different people that need to answer that question. So having a platform, a telehealth platform that also helps your team be more efficient by getting those messages to the right people when they come in, it will go a long way. That will really pay dividends to both your patients, but also you'll have a happier staff. That's certainly what our clients say to us. And with those right conversations to the right people, you want other capabilities to make those conversations even more effective and efficient. So when you have options like paying by text and language translation, think about the fact that for some of us with either limited office hours or we've closed our offices, but we want to stay connected, we no longer have our translator in our office within our four walls, but we still have those needs for translation. So having a platform that allows you to, for your patient to be able to message in their native language and for you to message back in yours and keep that conversation going, super important. Video, again, as I said, is a fantastic additive to your texting platform. Again, not every triaging and clinical conversation has to be a video. I would really stress a no app, no download, no login approach for your patient. It's just simply the easiest way to drive adoption to your new virtual care offering. A couple other things here. We talked about your staff staying connected with each other. So making sure that you're looking for a platform that not only completely virtualizes your patient care continuum, but also make sure that you have a way for your staff to engage with each other in a compliant way and not having any of those conversations on their personal cell phones. And then last, I'll leave you with the fact that security is still really important, and choosing a vendor that has also taken kind of extra measures in order to ensure not only full HIPAA compliance, which is also inclusive of encryption and logging and tracking. But when you look at what really makes a difference for most practices, it's also looking for that ONC certification. So if you're a facility that has a fair amount of Medicaid patients, then you for sure want ONC certification. Thanks to meaningful use, you can certainly benefit from additional reimbursement benefits there. But you need a solution that has all the proper logging in order and reporting in order for you to submit appropriately. So ONC certification along with full HIPAA compliance, really important. So as we wrap up here, just a few takeaways. You know, with our new normal, with the paradigm shift that we have all seen occur, telehealth is not an option anymore. Telehealth is not what everybody used to believe it to be, which was only video and only provider to provider. Telehealth today is delivering virtual care that can be patient initiated, that is patient to provider or patient to staff, clinical staff, office staff, which is going to help you to deliver the highest quality of care and while leveraging your technology. Make sure that your patient has the easiest access to you. And remember that consumerism is here in healthcare, and so patient convenience is going to be king. Leverage that platform, make sure that it's how you and your staff exist and operate to keep everybody connected, to keep everybody safe and at ease as far as their ongoing care, how they can reach you. how you can ensure that they are also managing their own health issues. So with that, I want to thank everyone for listening today. In lieu of having the ability to take live questions, again, due to our earlier technical issues, I've listed my email below, which is kathy@rhinogram.com. And I really encourage you to please email me directly your questions. I would love to answer them, any questions you might have. So with that, I thank all of you for your time today. Please be safe, please stay healthy, and let's get through this together.